At the outset, let me thank the organizers. Well, the topic is, can brain brakes be lifted? It's a treatment of adult amblyopia. It's a pilot study. I don't have any financial interest in this software. Well, this cloud-based dioptic therapy software called Binox is basically designed for binocular vision assessment as well as therapy, and it employs simultaneous and separate stimulation of both eyes using anaglyph goggles. It has got both diagnostic and therapeutic modules, of which I have used the therapeutic module of amblyopia computer-based games. So the purpose of this study was to evaluate the effect of dioptic amblyopia treatment on best corrected visual acuity and stereopsis of adult amblyopic patients who were aged more than 18 years. It was a non-randomized, interventional and prospective study. It's difficult to get adult amblyops, so somehow I could manage to get 13 adult amblyopic subjects with either anisometropic or isometropic amblyopia with refractive error, and the age group of 18 to 52 years with the mean of 26.11 years. Inclusion criteria: all were diagnosed cases of either anisometropic or isometropic amblyopia with associated refractive error and stable vision. They may or may not have been treated in childhood, and they were willing to participate in study with the informed consent. Exclusion criteria: any associated ocular or retinal pathology like say cataract, glaucoma, maculopathy were excluded. Just to avoid confounding factors, systemic diseases like diabetes and uncontrolled hypertension were excluded. Strabismus and also histopenia ocular surgery, they were also excluded. All underwent complete ophthalmic evaluation, although they were adults, but I did, at least for the first visit, cycloplegic refraction because most of them had hypermetropic error. Best corrected visual acuity with Logmar and Snellen equivalent, and BSU was checked using TNO. Post treatment, the same set of evaluation was done, and the follow-up was done at 1, 3 and 6 months. Since this is a cloud-based software, any desktop or a laptop with a LED screen of minimum 11 inch with Google Chrome browser and either Google Meet or Teams or Zoom installed in it. Of course, you need to have good internet connectivity with minimum of 512 kbps speed. In the therapy session, both therapists as well as patient connected remotely through either Zoom or Teams or Meet. Patient used either red, blue or red sign anaglyph glasses. One-time calibration of computer for size and color was done using anaglyph. 30 sessions were given of dioptic therapy, and the duration of the session was 30 minutes per day. Post-therapy improvement was seen in vision as well as stereopsis. So of this total 13 patients, 7 were males and 6 were females, and the range was between 18 to 52 years. Interestingly, post-therapy improvement was seen in distance best corrected visual acuity, which was statistically significant using Wilcoxon sign rank test, and improvement in stereopsis was also statistically significant using McNemar test. So this is a cloud-based, I'll just take 30 seconds more. This is a cloud-based program, and most of them were parents of the amblyopic children because they suggested me, my children has improved, can we try this? So that's how I landed up doing this study. So of course there are limitations. What are the long-term results? More than 6 months, they are yet to emerge. And efficacy as a primary treatment, we don't know. And obviously it requires long-term studies and large sample size to prove its effectiveness. So to conclude, best corrected distance visual acuity and stereopsis of anisometropic and isometropic adult amblyopic subjects improved after dioptic amblyopia therapy, and it was maintained through 6 months of period, and it requires long-term studies with large sample size to prove its usefulness as adult amblyopia treatment option. Thank you for kind attention. Any questions?
Have you compared the patients who have undergone any sort of treatment before starting Binox?
Most of them had
some treatment, which candidates who have not done any treatment, or somebody has done
some were treatment naive, some have done treatment.
So have you compared between those two
no,
groups?
because sample size is too small. It was very difficult for me to, because of this exclusion criteria, to get 13 patients. So I appeal to, I'm from Pune, so our Pune Ophthalmic Society, and many of them have referred some of the patients. So that's how I could gather 13 patients, but 13 is a big number.
Okay, and sometimes we see, suppose the children or patients, adult patients who are not underwent any treatment
Yeah,
so far,
yeah.
are
I
real
have
good
not-
candidates for
I have
binocs
not
treatment.
treated,
The
its
fresh
sample size
and-
is too
yeah.
small.
So
So-
were they densely amblyopic or moderate amblyopia? What was the starting vision in this? Like, was the
Around
results
636,
most of them?
most of them 636, 636, 624,
And,
and of course, as what the software these people claim, you do not get 4 or 5 line improvement, just a line or two,
Okay. And
but
in
which is statistically significant.
And in isometropic amblyopia, how many were ametropic? Because you've included both, so did you
Yeah, if
differentiate?
you,
them with
I have
the-
this data, maybe because of want of time,
Sure.
if you want, I can share it to you.
And how many of the patients had been doing patching, so first line treatment when you started binocs?
Most of them had done patching, but which was half-hearted
So did
in
you
childhood,
continue
because
this binocs with the patching, or you just stopped patching and just did only
they were
binocs?
adults, they were not doing patching when I enrolled them, but they had done patching when they were children.
Okay.
Some of them had done patching, some of them have improved.
Okay, with what we do, most of the practitioners do is, like, in case if they are doing patching already, we add as a complementary
Yeah, yeah,
procedure
yeah.
with patching rather than stopping the patching and
In fact, I done a
substitute.
study in small children with comparing patching and this thing, but since they were adults and some of them were just only a couple of them were treatment naive. Otherwise, almost all of them had done some patching which was half-hearted or full treatment. Some have improved, some may not have improved.
Good, thank you. And this gives a hope to the adult population, at least something.
I don't know what is going to
something
happen
can be
after 5
tried
years,
rather than
but,
giving them no hope.
and most of them were parents of my the amblyoptic children.
Okay.
So that's how they only suggested, can we try? We can try. We can just say what happens to you. We have nothing to lose. Thank you.
I have experience of 3 patients in 13 cases, but I did only, like sir said, only pure full patching,
Yeah.
total patching, but they were highly motivated. That is very important, because patching in adults it becomes very difficult, but then 3 of them really improved. So without even the additional achievement, pure full.
Yeah, so it will be interesting to see head-to-head trial with the patching and the dichoptic.
How
But I
much
think we need bigger sample size.
How much improvement? Like a line or two, or better than that? Only by patching? Better than that?
Thank you.
Thank you.